Next Level Conversation with Jeff Gabriel.
What's up, Bernie? How are you?
Hey, Jeff.
It's 9 o'clock and it's September 9th. Welcome to the Next Level Conversation. How you doing this evening? Appreciate you joining in.
Sure. I appreciate the invite. I'm doing good.
Yeah, I've known you. How many years have we known each other? We've known each other a long time.
Oh, God. I think it's like 20.
20 years?
Right? 20 years. Yeah. We were both young, good-looking men back then.
Right.
Well, we're a bunch of old farts.
Speak to yourself. I'm still pretending. Just a little bit about you, Bernie. Bernie's well, you're a jack of many trades. You're a ophthalmologist. You're a serious tennis player. You're an avid collector of extremely old cameras. You're a stand-up comedian. You're huge into electric cars. You're one of the first people to own a Tesla in the state of New Jersey. So you're very fond of Elon Musk and his company. And you're just an overall super intelligent guy. So I thought it'd be interesting to have a conversation with you tonight. So tell me a little bit about how you decided to become an ophthalmologist and the initial path. When did that start leaning towards becoming an ophthalmologist?
All right. Well, it's actually going to be really hard. I'm going to try to do a sort of a Cliff Notes version because I didn't do it directly. You know, if you were interviewing other ophthalmologists, they would probably have, almost certainly have a different story. I went through kind of a circuitous path. So when I finished medical school, I was initially going to go into neurology, and
perfect, which is a perfect field for people of the Jewish faith.
Yes, ophthalmology too.
Right.
So you know, I applied. I got a residency, and it was a 3-year program, which was at Yale New Haven Hospital. I went up there, and I actually started the program. And realized after about 1 year that I had made a mistake. It just wasn't for me. What attracted me to medicine in the first place really was surgery. I had been exposed to that when I was in high school. They had a volunteer program where students could go and watch operations at a veterans hospital.
Mm-hmm.
I did that, and I was really turned on to doing surgery. And that's kind of after that, what got me into becoming, pre-med and then, going to medical school. And I kind of got off track there. I was always interested in the brain and spinal cord, and I did some research in college. And so that's how I wound up in neurology. But the actual practice of it does not involve any surgery. There's no procedures. You don't use your hands, at all. And also for me personally, it was a sort of a frustrating field in that it's more of a diagnostic. You make diagnoses of strokes, brain tumors, seizures, but you can't, you can't help people in a dramatic way, or at least as dramatic as I wanted it to be. So again, I'm gonna fast forward here. So I did 1 year there. I had a friend who was an ophthalmology resident, and he suggested that I switch into that. Getting into ophtho is difficult. They have an early match, it's called, and it's very competitive. Anyway, to make a long story short, I sent my CV out to all the ophtho programs in the country. I quit the program. I came back to New Jersey. I got a job in an emergency room just to kind of kill some time. Yeah. I did that for about a year, and out of the blue, about a year later, I got a call from the Boston University Department of Ophthalmology saying they had an unexpected opening. That was a Sunday night. They told me to fly up the following day on a Monday. I flew up there. I got the spot, and a week later I moved to Boston, and I was doing, ophtho. And I loved it from day one. It was like I was pretty miserable as a neurology resident, and it was like I had come home. I realized that this is where I belonged. I felt like the other residents were, like me. We were simpatico. We got along. We had the same interests, and ophtho is just a great field. I mean, the eye is an amazing structure, and the surgery is extremely precise and elegant. We can do amazing things. And, to this day, I've been practicing now for, 30 years. And I'm not tired of it at all. In fact, some of my colleagues are now retiring, and it's not something that I would even consider. I'm operating, I have a full surgical schedule. I did, 12 cases yesterday. And I'm learning all the new procedures. I'm trying to keep pushing and challenging myself with new procedures.
What's the new latest and greatest, in regards to eye care?
Well, I can only tell you about, what I do, which is mostly cataract surgery and glaucoma procedures. And now the newest thing is combining cataract surgery with glaucoma. So glaucoma procedures. So patients who both have cataracts and glaucoma, we can treat in one procedure while you're already inside the eye. In addition to, you take out the cataract, you put in an implant, which allows the patient to see well. We can put in various drainage devices. And in fact, yesterday, for the first time, there's a new implant where there's a medication, which is in the implant that we injected into the patient's eye, and it's going to stay in his eye for a year or two, right, which will allow him to not use eye drops for that entire period and get even more of an effect from the drops. It's, I think it was just a great thing. So
besides glaucoma, besides cataract surgery, obviously those are the two mainstays that you do. What are some of the mainstay surgeries that other eye doctors or surgeons are doing these days? What else do people have? There's retina detachment.
Well, there's lots of them. Ophthalmology is divided actually into 9 subspecialties. What I do is, considered anterior segment, meaning we operate in the front of the eye. The retina guys, they operate in the back of the eye. Then there's the cornea, which is, you probably heard of, LASIK, those refractive procedures so people don't have to wear glasses. That's operating on the cornea. We do that too. And, each one of these subspecialties has its own procedures that are just unique to that subspecialty. And for instance, cornea, they specialize in corneal transplants.
Right.
So they're doing, the latest and the greatest type of transplant. And ophtho is a very technology-oriented field, so things are changing very quickly. We literally do sometimes, I would say, a new procedure like once or twice a year, it's pretty quick.
So you're constantly learning, right?
Yeah, that's what's great about it. I love learning the new procedures. Since COVID has, we were completely shut down there for, I guess it was about 4 or 5 months.
Yeah. Did you feel like you were out of practice? As you know, I fly, and if I'm not, if I don't get a chance to fly after a while, it feels, I feel not connected to the aircraft.
Yeah.
I feel at one with the aircraft. It takes me time to get my skill set back.
Really?
It's not like I forget things, but, I have to concentrate harder to make sure I don't, misjudge something or not pay attention or follow a checklist properly. And I'm sure in surgery, if you don't do it,
Well, no, actually, it's not like that. And I'm glad you told me that, in case next time I fly with you, I'm going to find out, how long a break you just took.
Right.
But I was a little concerned about that because it had been the longest period that I had not done surgery for.
Right.
Before that, it had only been a week or two when I take a vacation. And I noticed even after 2 weeks that it took like one or two cases before my hands were kind of in the flow.
You got like someone's eye, on the end of a scalpel. I'm sorry, it's COVID.
Well, no, but what I was going to say was that it's like for me, I think probably for most surgeons, it's like riding a bike. It's muscle memory. I've done, I kind of ran a rough calculation once. I've done over 12,000 cataracts.
Wow.
And so, at some point, you could just sort of almost do them in your sleep. Yeah, you have to kind of reacclimate because, everything's done through a microscope and it's, completely different world. But Actually, I did just a small number of cases the first day back, and I realized after right away after a couple cases everything was fine, and we're totally back to normal volume now, and so I'm actually a little bit surprised about what you said with the flying. That how long do you think it takes for you to feel back to your peak skills?
Well, like I said, there's some muscle memory, but when you get, let's say, like a large helicopter, there's a lot of exterior environmental, there's noise, there's sounds, there's some vibration.
Right, but isn't that always true? Whenever you're flying, there's always going to be.
But you have that. You got to get reacclimated, even though you have a noise canceling headset, and the helicopters are advanced with noise insulation, and the interiors are ensconced. You have to get used to that feel, and you start moving around again, and those different senses and noises and feels can take your mind off what you're looking at in the cockpit. I'd say a couple of hours, but there's two people up front. You're not going out by yourself, even if you have a lot of experience. The bigger helicopter, you have two pilots, so you're fine and you're safe. It's just I didn't fly for 45 days at one point.
Yeah,
it was the longest that I haven't flown for a long time, and that was usually before that it wouldn't go any longer than a week. I was running the business, so that being a pilot is not my mainstay, but the corona really affected the quarantine, the everybody staying home, and the virus, the disease. People were home for a long time. I was out on the highway driving sometimes on the turnpike, and it would just be like me driving by myself, like a Mega Man. It was. Yeah.
Oh yeah. Look, we got hit hard here in New York, New Jersey. It was just it was a ghost town. But we were seeing patients right from the beginning. We were seeing emergencies. Mm-hmm. All physicians were considered essential workers, and we were asked to continue to see patients. Oops, sorry about that. As much as we could. So, we did. From day one, we saw emergency, and there are legitimate eye emergencies, and
were you nervous?
Not every patient I saw. I was only seeing probably an average of 5 to 10 patients at the beginning, mm-hmm. and I would say half of them were legitimate emergencies, and half of them were just people who thought they were legitimate emergencies.
They just wanted to see somebody.
Yeah, maybe. But there was a lot of fear. Also, people weren't coming. There were also, on the other hand, there were people who should have come in, who were afraid to leave their house. Mm-hmm. And we saw a bunch of patients who came in when we got the go-ahead to open up to normal conditions. Right. We saw a bunch of patients who had retinal detachments and all kinds of crazy stuff that needed to be treated a month or two before. Were just afraid to come in. I heard the same thing from some cardiologists. They said that there were a lot of strokes and heart attacks that patients just ignored. They had chest pain, but they were more afraid of going out and getting COVID than dying from a heart attack.